I don't know. Okay, let's use Zinc data frame. Let's use Zinc. Yeah, so let's start with Zinc database. Okay, so this is Zinc database. Zinc database is also, another database that is being used for identification of drugs, small molecules, and it has over 30 million traceable compounds. So this compound, it has over 20 million compounds, and this compound they are freely available on the for purchase. And anytime you are doing any work and you are using this database, you cite this. You have to cite this database, and this is the citation Sterling and Irwin 2015. So now let's go to you can come to this place to substance and search for any drugs of your interest. You can search for your drug. You can come here and let's put Tenanolol, for example. You can put Tenanolol, for example. That's one. Another thing, you can copy SMILE, canonical SMILE. You may be asking, what is SMILE? There are different. Canonical SMILE is just a skeletal representation of a structure. And let me show you something on PubChem that we did last time. If you remember last time we talked about PubChem, right? And I made it clear to us that, for example, this is well-seen compound. So if you come here, there is always, you can get the canonical. Let me show you what canonical SMILE looks like. This is a canonical SMILE. Can you see? This SMILE is just a skeletal representation of a structure. So when you want to work with Zinc, the Zinc database, you can just copy this SMILE. So there are different ways. One, you can type the name of your compound and you search, or you can paste the canonical SMILE of whatever drug or compound you are interested in. You can place it there. So if you place it there, once you do that, that will be a great one, and you can just say, okay, search. So let us do the search by name first. So can you see? This is acetaminophen, that's Telenol, and this is another compound that is similar. Can you see? But this is the one you are interested in. So by the time you get that, you can just click on it, and to give you information, just like the PubChem also. Can you see? It gives you Google information, Wikipedia, and even PubMed. PubMed is like PubChem, but PubMed is for journals, medical journals, medical articles. And you can see this was added in 2018, available in stock in case anybody want to buy. So this is the molecular weight of Telenol. The ring, it has just one ring, heavy atoms, heteroatoms, and the rest. So it gives you the same information, just like PubChem. Why I'm showing you this different type of library is because there are times you want to work with your project and you are not getting your compound from PubChem or from another database. So, but by the time you try all the databases you are looking in this lesson, you'll be able to get, at least you will get your compound. So that's the concept. That's why I'm concerned about showing you guys every possible database, and this gives you a lot of information about your drugs. When it comes to drug design, all this net charge, hydrogen bond as donor, hydrogen bond acceptors, PSA, stable bond, all of them matters a lot. And you can download all this information as much as you want. Can you see? You can download, so it has a lot of information about your drug, and there are also, it will give you some interesting similar compounds. So you can see this is Telenol. Can you see another one, another compound, another form of it? So we can give you similarity identity. So that is it. So apart from PubChem, and these are other studies that are currently going, clinical studies that are currently going on Telenol. So these are clinical, in case you are interested in knowing which clinical studies is going on in the US or another part of the world, it is here. So you can get that here. So once that is done, so let's go back again. Let's go back and try. Let's go back and try with canonical smile. So just paste your canonical smile here and click search. Can you see? Okay, so no, this is not. Okay, I forgot to delete it. No, okay. So canonical smile and click search. Can you see? This is the structure of the horizon B that I copied now. So can you see? So we are this. So you can see that you can either type the name of your drug or you copy the canonical smile of the drug and to give you the same thing. And once you know that, just click on the structure and to give you information about. So that compound is acetamido eugenol. So this is, can you see, this is the canonical smile that we look at the other time, and it also gives you some other information about your compound of interest, your drugs or compound of interest. So, and apart from this canonical smile, you can download structure, either 2D structure or 3D structure of your compound on your laptop and just upload the structure. If I should click on this now, it uploads and take me to maybe, I don't know if I have any, I can't remember if I have any structure somewhere. Let me try. Let me see if I have any structure close somewhere on this. I'm coming. Let me see if I have any. So you can just come here and this is not. So once you have, I can't remember where I have structure on this now. So once you have any compound that you've downloaded the structure and you want to know much about that compound, you can type the name or put the smile or upload the structure once it has been downloaded on your laptop. So those are the ways you can do. Another way you can do is, there are times you have some drugs you don't even have idea about, you can't get the structure, the either smile or whatever on the internet. You can draw your own structure here. For example, let's draw. Just click on this and place it here. Can you see? So maybe you want to put a single bond somewhere. Put a single bond. You want to put hydrogen, oxygen rather. Can you see? Or you want to put a double bond somewhere. And so you can draw your own structure. And as you are drawing it, you will observe something. As we are drawing this, it's giving us the canonical smile. Can you see the smile there? It's giving us the smile. Can you see? As I'm doing the structure, it's giving us the smile of this structure. So let's put another single bond somewhere here. Can you see? And let's put chlorine. I'm just saying, for example. So can you see? So, but if you have a structure you want to draw yourself, that would be great. You can put it there, and this is the smile. So just copy the smile. Take note of this structure, and let's go and copy the smile here, and let's search for it. Can you see? It gives us something close to that. Though not exactly, but it gives us something close to that structure. Let me go back. So those are different ways you can draw the structure. You can get more information on the Zinc database. So another database I want to show us is the Swiss Similarity. Swiss Similarity is by Switzerland Institute of Bioinformatics. So this is it. So this one is straightforward like the ones we've talked about. So you can put the smile, enter a smile you can enter a smile there. So these are some of the smile I've done in the past. You can put the smile. Once you put the smile, okay, what do you want? Are you looking for? So once you put the smile, what you are looking for, is it a drug? Is it a active compound, or are you looking for a synthesizable compound? So let's say you are looking for a drug now. So if you're looking for the drug, it will ask you, do you want the drug? Do you want a pharmacophore? A pharmacophore is like you want something similar, or you want a combined or 3D or any one that you want to just choose. or do you want it to come from Temple approved drug? Temple is also another database that's being used for identification of drugs. Temple drug candidate in clinics. All this, just click one of your interest and submit. The moment you submit, it's going to run and it'll tell you application currently running, runtime. So it's going to take, it will take some time before you get information about before it gives you the list of compound. Can you see this now? So this is the drug we pasted. Can you see this? So now this is giving us this is our compound, and we are asking for looking for compound that are similar in structure to our own compound. That is what it is. So this is our compound, and it's giving us a suggestion that this compound is similar to this, but the similarity score is 0.2. This one is 0.294. This one is 0.28. So when you are designing drugs, there are times you want to look for maybe you want to design maybe lopinavir, for example, that is used for HIV, and you are looking for a drug that is similar in structure to lopinavir, and you want to see if that drug can also cure HIV. So instead of you thinking, maybe because you are not in chemistry, you don't know how to put those structures. All you just need to do is put the structure of the SMILE on this server, and this server is basically AI-based server. Just put the structure there, and the list. Can you see hundreds of lists of compounds that are similar in structure to your compound of interest? So that's the way it is, and this has been used a lot to identify different type of drugs. I'm telling you, more potent. Don't be surprised if this is a drug that is used in treating COVID. I'm telling you, there is tendency that you will get more drugs here, more drugs that will cure COVID and even be more potent, critically potent than the parent drug. So all this has been employed, in drug discovery, and that's why I'm taking us here. What we are doing here is just a preamble of where we are going. So that's the way it is. So just to give you an idea, because I'm telling you, with time, we are still coming back to download structures from all these databases. So that's fine. Any question? Any question, anybody?
No question, sir.
Okay, so you get it. Drug bank. I want to try drug bank. Let's try drug bank again. I don't know why that's giving me. Okay, this one wants us to register first, but there should be a way I should be able to browse drugs. Okay, now you will not need to register. So now let's look at this now. This is another database. It's called drug bank. So it's because there are a lot of drugs there. So let's try search for. You cannot just come to this place, the name of your drugs, and search for it. Can you see? So this one too is giving us information. Is called acetaminophen. Summary of the drug is an analgesic drug used alone or in combination with opioid for pain management and as an antipyretic agent. So it gives you, this is the generic name, this is the drug bank accession code. It gives you some, just like it gives you some background about any drugs that you are looking for. Can you see that? It gives you the structure, the molecular weight. It gives you the synonyms. It is, some we call it arsenal, some call it acetaminophen. This is the spelling. I think this should be a Spanish flag. This is first. So you can see indication, in case you want to know what are the side effects and some other things, information about it. Associated condition. These are the conditions that is used for also. So this is the pharmacodynamics of the drug. This is the mechanism of action of the drug, of it. This is the absorption. It has 88% oral bioavailability. Volume of distribution, protein binding, metabolism. So all these things, half-life, the route of elimination. So it gives This document also give you a lot of information about any chemical structure you are, either a drug or whatever you are interested in looking at. This also gives you a lot of information about that. So I think that's that. So that's that. We've looked at different chemical libraries. We've looked at PubChem, we look at Drug Bank, ChemSpider, we look at Zinc database, and switch Similarity to identify compounds that are similar in structure to our drugs. And we are going to do, and by the time we get to the project, during the course of the whole thing, we are going to work on that anyway. So now so any question from anybody?